You ruined us with sleazy business practices and a complete disregard for human decency.
Science together, we moved forward with isolation recommendations of 5 days of isolation followed by 5 days in a mask. Now, the question of why we didn't include a test there is simply because we know that PCRs can stay positive for up to 12 weeks. So we would have people in isolation for a very long time if we were relying on PCRs.
If they could find this virus in you at all, and with PCR, if you do it well, you can find almost anything in anybody, because if you can amplify one single molecule up to something that you can really measure, which PCR can do, then there's just very few molecules that you don't have at least one single one of them in your body, okay? So that could be thought of as a misuse of it, just to claim that it's meaningful. But PCR is separate from that. It's just a process that's used to make a whole lot of something out of something. That's what it is. But it's not, it doesn't tell you that you're sick, and it doesn't tell you that the thing you ended up with really was going to hurt you or anything like that. That's why it's not.
General testing and PCR testing, whether you should test asymptomatic people, just symptomatic, how many contacts. Dr. Bhattacharya, what is the this asymptomatic testing with PCR, but particularly I think one of the things that's been put out, the New York Times had an article about a month ago looking at some of the test results in New York and in, I believe, Nevada and Massachusetts, and they found that because the PCR tests are so sensitive that up to 90% of the positives were not identifying live infectious virus. And then I think there's other studies that have come out. I know Oxford's Center for Evidence-Based Medicine says that if you have such high sensitivity, you cannot be there's no guarantee you're even identifying live virus. And I think that, I guess, one, just what does that mean for some of the testing and the case numbers that we see? But then two, it seems to me that if you're test positive with no symptoms with a very sensitive PCR test, and they can't even tell you if you're infectious, we're quarantining across the country probably hundreds of thousands or millions of people who aren't even contagious. And I think that obviously has a huge cost to society. Doesn't seem to be getting a lot of discussion.
Some Vermonters who are able to find antigen tests and then test positive are clogging up emergency rooms. Rutland Regional Medical Center's emergency department has been overwhelmed with asymptomatic people.
Emergency measure has been passed in New York calling for new safety requirements for reopening schools.
Governor Kathy Hochul says all teachers, administrators, and other school employees must submit to weekly COVID-19 testing unless they show proof of vaccination.
The corporation is downsizing the people and upsizing their profits.
Do you know what we're doing today?
Yeah, COVID testings.
Yeah. Hi, I'm Dr. Katie Punica-Worms, a pediatrician with New York City Health and Hospitals. As a doctor for our city's children, I know that keeping our kids healthy means keeping our schools safe from COVID-19. That's why, together with our partners at the New York City Health Department, the New York City Department of Education, and the New York City Test and Trace Corps, we're bringing COVID-19 testing to schools to keep our students safe and our classrooms open.
Marvin! I'd knock that shit off if I was you.
In Berlin's theaters, there's an acceptance that you can't be safe enough. Audience members have, of course, to show their vaccine passport, but also a negative test less than a day old.
100,220, 100 and... I lost count!
I feel a lot safer now. With this double system, I can at least go to the theatre a lot more often.
This is insane.
It is. That's the point.
The new rules, passport and test, came into force at the end of December in cultural venues. Another constraint, but a welcome one, as attendance was dropping in recent weeks.
We have felt a lot of hesitation from the public in recent times, but with the resurgence of the pandemic, the new measures are rather well accepted.
You serious?
The double system could be copied across Germany as the overall situation worsens with the spread of the Omicron variant.
Attention, new New Yorkers! Stop!